Hello everybody, Colleen here. It's been a minute since I did a video. Today what I'd like to do is show you what I do in my occipital neuralgia decompression surgery physical therapy. So the concept is for us to get a stronger neck and to be able to get more strength and flexibility in the neck and also like in the traps here. So a lot of people, when you're dealing with occipital neuralgia, you're dealing with the nerves that basically go from your neck all the way up to the top of your head. My surgery was on 4 nerves, the 2 greaters, and then the 2 lessers. The nerves are starting to wake up, so I do have some pain in one area. It's been pretty consistent, so I see the doc in a few weeks, and we'll see what he says about that. But I'm going to show you some of the things I do in therapy. If you have occipital neuralgia and you do these, it will probably be uncomfortable for you. And then of course, there's people that have the surgery and they don't go to physical therapy. So this might be, with your doctor's permission and guidance, this might be something you might like to try. So the first thing I do is a lot of neck flexing stuff, and I do have some trouble. So the first one I do is lifting your chin up, and I do this 10 times, and then looking down. And you try to go as far as you can. The looking up part, I start to feel a little pain in the back. Down is a good stretch, but not super painful, right? So I'll do it up and down is 1. The next one I'll do, look as far to your right shoulder as you can, and then as far to your left shoulder as you can. That's 1, right? And that's 2. So I'm still noticing that I still have some pain and some stretch when I look to the left. We'll see if that can improve. Now the next one is like a head tilt. So this way you're stretching your muscles in your neck over here. So you go to the side and to the side. That's 1. Right? So these can get a little weird too. Okay, so the other thing we do, again, because we're working on the shoulders, is just simply lifting your shoulders up and back as far as you can, right? So you're gonna do that 10 times, maybe 2 sets of 10. Again, you're doing nothing without a doctor's permission. I'm just showing you what I do. And then the other one is to kind of squeeze your shoulder blades together. So I'm kind of pushing these back, and I'm doing that. Now, these I do sometimes and sometimes I don't. He has been doing some like fascia release and muscle work in my head, and it's just caused way too much trouble for me. I was in a car accident, so I also have vestibular migraines and persistent post-concussion syndrome, so I have a lot of other things going on. The other thing is, when I had my accident, I did injure my jaw, and that was 2.5 years ago, but we're noticing the more he works on different muscles here, it is affecting my jaw, so I'm getting some imaging on that soon. Anyway, so the other thing we do, and again, this is for neck strength. So I'm gonna put pressure against my head this way, and then I'm gonna push into my hand. So, again, when you first start this, you're starting at 10% pressure, right? And then I'm gonna do the same thing over here, right? And again, I'm moving my head, and I'm not killing it, and then I'm just using my hand as resistance to push back. So I can feel that. I can feel it, in these muscles and these nerves. I can feel it in the back of my neck. And then, so we did side to side. Now you're gonna do front. So I'm kind of pushing forward, and then I'm gonna push back. Right, so you figure about 5 seconds forward, 5 seconds back. Now, this one can kind of ramp up the pain for me. Excuse me. So you really just have to talk to your physical therapist about that. I also have some bands. I do some rows this way, and I do rows this way. And I do some face stuff, but we've had to stop that because it's causing a lot of pain. But I'll just show you real quick. It's really just like leaving your jaw a little bit slack like this. And then just like we did with our head, you're gonna push your jaw over to the right. And I'm gonna resist, I'm gonna push it back. Same thing. So that's gonna work. All these muscles, like they're all connected. It's a whole thing. It's shocking. I think when you have, a rotator cuff issue or back issue, shoulder issue, head issue, neck issue, you realize like, whoa, like you do a little thing over here and it's gonna affect up here. So we had to actually stop the jaw stuff. And then we did some stuff like just squishing our face and then opening it real big. And again, you have trigeminal nerves here, so you know, if you have some of that going on, you have to be careful. So anyway, that's what I'm doing right now. We just started doing a thing. I get a little dizzy. I have vestibular migraines. Is I stand in front of a door, so the door's in front of me, and I put my hands kind of by my side, and then I lift them up. And I can't do, if I look up, I fall backwards. So I can't do that. So I usually close my eyes and I'm doing this. And you can feel this awesome stretch in your mid back, the top of your back, your shoulders. It's awesome. And then back down. So I only do like 5 or 6 of those and it kicks my butt, believe it or not. So again, if you have occipital neuralgia or something like that, trigeminal, those are some of the things you might do after you have your surgery, like I had. And again, I had it done in January and then I had a revision in February. So I don't know, I started about a month ago, but it's going well and I do feel a little bit stronger. Like I said, when I'm done with this, then I have to do vestibular therapy. A little worried about that one. We'll see how it goes. I'm also gonna make another video because I just started cognitive therapy. I've had some problems with my processing and thinking and memory. So it's really cool. So I'm gonna do a video on my cognitive therapy as well as the testing that I went through. So that's really it. Good luck to everybody. I hope you're feeling well. I hope you have a great team of people supporting you and I hope you feel better. Thanks, bye.